Over 30 owners of unkempt properties have been issued notices to clean up their premises in 7 days or face a fine of $3,500 as the Ministry of Health ramps up efforts to curb increasing dengue cases. Sunil Lalla reports.
And we will be ramping up the inspections of properties by our public health inspectors and giving property owners a reasonable time to clean up their properties.
A warning to citizens from Health Minister Terence Dialsingh that the ministry has begun issuing notices for unkempt properties, which carries a fine of $3,500. 31 notices have been issued to property owners in several areas, 15 in County Victoria, which has the highest number of confirmed dengue cases, 10 in St. Andrew, 2 owners in St. Patrick, and 4 in Nariva Mearu. County Medical Officer of Health for Caroni, Dr. Janine St. Bernard, said although inspectors have the right to enter one's property while the owner is present, they will be taking a non-aggressive approach.
It's not like the public health inspectors will access your property in your absence. It's not like they're going to be breaking locks and coming in because, we're fighting dengue.
To date, there's been 229 confirmed dengue cases and 2 deaths, with 29% of the cases in County Victoria, 27% in Caroni, and 24% in St. Patrick. Minister Dialsingh, though, continued to urge citizens to engage in source reduction around their homes by emptying and cleaning vases, plant pots, and disposing of tires, noting that the rhetoric of cleaning rivers and ponds may not be the answer.
That the main breeding sites are in your homes. And the media keeps tugging me and the population to focus on big drains and rivers. Those are not the preferred breeding sites.
Technical Director of Epidemiology Dr. Avery Hines said dengue has been on the rise locally and globally.
We do not have hospitalization figures. We just know that hospitals have indicated that they're seeing more of these cases. We've taken note of that, and this is part of the reason that we are encouraging the population to take note of their symptoms.
And Specialist Medical Officer for the Insect Vector Control Division, Dr. Osafra Fraser, said the division has been engaging in ultra-low volume spraying for the Aedes aegypti mosquito, but warned against overspraying since mosquitoes will build up resistance.
We generally will do this if we have at least 2 cases in a quarter-mile radius in a particular area. We will go and do spraying.
Chief Medical Officer Dr. Roshan Parashram guarded against the use of certain medication to treat dengue.
In a setting where you have dengue being prevalent, it is always better to start with the simpler ones, which is not use the non-steroidal anti-inflammatories unless prescribed by a physician.
Minister Dialsingh is urging the population to seek medical advice if they experience any flu-like symptoms.
If the population is unsure, please stick with the safe, tried, true and tested paracetamol. It's 10 cents for one. You can get a card for $1.
Sunil Lalla, TTT News.
The Ministry of Health says it is against the use of vaccines for dengue, noting that the topic has been quite controversial. Speaking to reporters on Friday, Chief Medical Officer Dr. Roshan Parasram said there are currently 2 vaccines being used in some places around the world, but explained why the ministry has decided against procuring such vaccines for the population. The first one, he said, is known as Dengue, developed by Sanofi Pasteur for ages 9 to 45.
Now, if someone is seronegative and they're actually saying in their recommendation, WHO, that we should not use it in a seronegative individual as somebody who never had dengue. If we were to give it to somebody that didn't have dengue, it primes the immune system and increases the likelihood of severe dengue. So there is a significant risk there.
And he said another such vaccine, known as Dengue, for people 4 to 16 years of age, has also been controversial.
We have continued to collaborate with PAHO, as well as through our NITAG, which is our National Immunization Tag Group, Technical Advisory Group. We have been liaising to look at those particular issues that Minister raised and the recommendations for WHO to see if it can be used in our setting. So far, we haven't gone ahead and procured because of those controversial issues and those highly technical issues that we have to consider before we use it in our public. So it is under consideration at this point in time.
Health Minister Terence Dialsingh is warning citizens not to use chemicals to spray around their homes to get rid of the Aedes aegypti mosquito, especially without the proper protective equipment. Following media reports that citizens were using a chemical known as malathion to spray around their homes, TTT News asked whether such a move could be recommended. But he said people in certain quarters have attempted to use this to gain political advantage and put the lives of citizens at risk.
But what you have going on is a particular corporation in South Trinidad, seeing this, led by their political directorate, to see this as a political opportunity. And they are putting their burgesses at risk. And what happens? You use it in the wrong concentration. You kill everything around you. You destroy your own ecosystem. 2, they are not wearing respirators.
Minister Dialsingh also dismissed the recommendation of implementing genetically modified mosquitoes, which are used in Florida and Brazil, to reduce the Aedes aegypti population, noting there is no scientific data to show that it works.
The risk of introducing an invasive species of an insect into your ecosystem is unknown. 3, the risk to human health if these mosquitoes, which are genetically modified, mutate, as insects tend to do, as we saw with COVID. Things mutate. That is totally unknown.